Welcome, everyone. While the title of my talk is Healthcare Heartbreaks, it's also a story of healing, and it's a story of hope. Heartbreak number one. Here I was 26 years old, I was 26 weeks pregnant, and I had a beautiful baby girl at home who I delivered without any complications. I go in for my ultrasound, super excited. It's always fun to see your kid for the first time. The tech begins the procedure, and then the mood completely shifts. I watch his face become stricken. He starts to stammer something about going to get the doctor, and he starts to walk out of the room. I grab his arm and I say, "Please just tell me what's wrong. I can't stand waiting not to know." And he looks at me and he says, "There's no heartbeat." Stillbirths at this stage of pregnancy are rare. We were completely unprepared for this news. We were even less prepared for what came next. The OBGYN said that we would have to wait 10 days before we could deliver in the hospital due to lack of space. No one addressed the trauma of our loss. No one addressed the stress of not being able to deliver for over a week. The doctor knew I desperately wanted to know what caused our child's death. So he did discuss that the autopsy results might be compromised due to increased deterioration over the next 10 days. He did not discuss mental health. Y'all, I could not function for these 10 days. We didn't have streaming services like Amazon and Hulu back then, so I drove myself to the video store, I bought giant box sets of old television shows, and I just watched them on repeat, trying not to think. Keep this in mind as I tell you what happened next. 10 days go by, we finally get into the hospital. I delivered my daughter naturally, and it was an amazing experience. But I was in so much mental pain, I didn't think I could handle the physical pain on top of it, so I elected to have an epidural. I'm waiting on the anesthesiologist to come in and give me the procedure. He comes in, but then he gets a page, looks at it, sneers at me, and he says this: "I'm going to help a woman in real pain." I just look at the floor, he walks out of the room, and I say, "Does he not know that we just lost our child?" I find the nurse and I say, "Is there literally anyone else who can do this procedure?" And she says, "No." She says, "If you want to reschedule," and I stop her right there. I can't wait any more time to deliver. So he comes back in an hour later, does the procedure, doesn't say I'm sorry, no condolences, leaves. Then we're in the delivery room. And I told my doctor, I really just don't want to see our child after delivery. He accepted that, he finishes, he leaves. But then the delivery nurse turns around and she says this: "The least you could do is look." Now my students, those of you who are here, you know that I'm extremely passionate about patient-centered care and inclusivity. And on the occasion that I've shared this story with them in the past, I usually get a, "Professor Cardinal, did you go give that nurse a lecture she would never forget?" And y'all, I always wish I could say, yes, I did, but I did not. I was deeply heartbroken, I was in deep grief, and I had lost my ability to self-advocate in that moment. However, I did regain it a little bit the next day, and I called up the healthcare administrator. I said, "What's going on with your employees' disrespectful behavior?" Her response was this: "I'm sorry, but they thought you were having an abortion." Now, I had been to a health law conference the year before as a law student, and I had met hospital administration, but this was the first time I actually realized the power of healthcare administration to shape the culture of their institution. This hospital was not based in patient-centered care. They did not care for me at all, they simply treated me. No matter what your political views, shame has no place in healthcare. Heartbreak number two. Very excited, I got pregnant again, and my son Sam was born 100 years to the day on his great-grandfather's birthday. Now, jaundice is really common in males after birth. However, prolonged liver dysfunction is not. You can see on the right that's Sam coming out of a CT scan, which came back clear. So at that point, the doctor recommended that we start genetic testing. From the time we started, it took 12 weeks for us to get a diagnosis. And after that, it was just completely unexpected. So we're waiting these 12 weeks, and I gotta tell you a little background. So in Texas at the time of my delivery, we only covered 50 different diseases that we did for newborn screening. Since then, it's gone to 57. None of these diseases was my child's condition. So in addition to that, insurance, due to financial reasons, would only cover genetic testing in waves. So we had gone through the first panel, it came back clear. We went through the second panel, it came back clear, and we had just done testing for the third panel. And I had to go in again to get Sam's bilirubin levels checked. Normally I'd go to the children's hospital and I would nurse and they would let me go and it was all fine, right? So then I decide, I'm gonna go to this lab by my house. It's a little bit more convenient. I go in and I prepare to breastfeed and I get this. She says, no, you can't nurse in here while I take his blood. It's offensive. I went in expecting kind care, and I got shamed instead. So, continues on, Friday afternoon, after work, 12 weeks have gone by, and we're sitting there, and we unexpectedly get a call from the gastroenterologist office. It's always anxiety-ridden to answer that phone after you're waiting on blood test results, right? So we're waiting, and the nurse says, here's your son, he has a rare disease, here's the name of the condition, and literally nothing else. Hangs up the phone. So I'm consulting Dr. Google, I'm paying for articles from medical journals with my own money, trying to figure out what's going on, and I find out that the expression of my son's disease is vastly different depending on the phenotype. So you gotta believe, I called that call service right back, and I am waiting for the nurse to respond. She calls back about an hour later, and she says this: I don't know the phenotype. It was hard not to be angry in that moment, but she said she contacted the doctor and that he would hopefully get back to us that evening, but it might be Monday because he was traveling over the weekend. So we wait, and it was late by the time he called back. And when he called back, he said this. He delivered the news of our son's condition with this sentence: oh, you know those young adults that never smoke or drink, but they need a lung or a liver transplant? That's your son. He was shockingly cavalier, and he was extremely uninformed. This is extremely common in the rare disease community. We didn't even get an I'm sorry, but this time. We were at the mercy of the system, and we had to educate ourselves. Now, all patients have to self-advocate, but patients and parents of children with rare diseases, they also have to educate not just themselves, but their care providers. Heartbreak number 3. There aren't a lot of pictures of me between 2009 and 2010, and in most of them, I'm laying down due to limited mobility. However, in the picture on the right where I am seated, it showcases how much weight I'd lost. I was down to just 90 pounds. I had Bell's palsy on half my face. I was having extreme muscle spasms throughout the day, most days. I'd lost considerable muscle mass, and I was extremely weak. I remember at one point I went to go push an elevator button, and I didn't have the strength to get it to work, and I had to get someone to help me. So over a 9-month period, I saw 12 different specialists in Dallas-Fort Worth. The first one we saw was an ENT, and he did a bunch of blood testing. And then he comes back with this: the blood test says you don't have Lyme disease, but I'm still gonna treat you for Lyme disease. Y'all, this is not evidence-based medicine. The last specialist I saw was a neurology professor, and while he did not accurately diagnose me, he was able to refer me to the Mayo Clinic in Rochester, Minnesota. Mayo Clinic is a marvel. Within 48 hours of my plane landing, I had an ultrasound, I had a biopsy, I had a cancer diagnosis, and surgery was scheduled for 2 weeks later. I went through 2 rounds of radiation, and I've been cancer-free for over a decade now. Y'all, I'm one of the lucky ones. Most young adult cancer patients spend much longer undiagnosed or misdiagnosed. In a recent research study, the rate of cancer in Americans aged 15 to 39 has risen 30% over the last 40 years. Now, I didn't cry when I got my cancer diagnosis, but I did cry when my oncologist said, I don't understand how all these specialists missed this. My cancer story's heartbreak, it wasn't the diagnosis, it wasn't the treatment. It was the 9 months I spent in bed while my son said things like, Mommy lost her superpowers. Now, cancer treatment wasn't exactly a picnic either. I'd gone in for surgery, and I come out, and I don't like pain medication, so I was trying to be brave when they first offered it to me, and I said, no, thank you. But 2 hours went by, and I'm contacting the nurse, and I'm like, hey, can I change my answer? I need those pain meds now, please. And she looks at me, and she says, no. And then she says, you're not really in pain. The woman right there who just had brain surgery, she's in real pain. I'm not even going to address the HIPAA violation with that statement. Suffice is to say, I was at my wit's end by this point. I couldn't keep seeing this problem, this lack of empathy in healthcare, and not do anything to address it. Now, I did contact medical boards about some of the people that contributed to my healthcare heartbreaks, but even though I'm an attorney, I did not want to sue the healthcare providers. What I deeply wanted to do was help shift culture and make healthcare more patient-centered and more inclusive. So I go back to school, and I studied public health, and I learned that the gender bias I experienced in pain management was extremely common. And I learned that the prejudice and the discrimination that I saw while taking depositions in my law practice was also deeply embedded in our healthcare systems. But I also found a community of people working to address these inequities. The more research we do on patient-centered care, it continues to show that when healthcare institutions address cultural and structural competence to reduce health disparities, we get improved health outcomes. Health equity decreases morbidity and mortality rates. I'm hopeful. I'm hopeful because I come to work every day and I see my students and I see my colleagues working hard to increase diversity, equity, and inclusion on campus and in healthcare. I'm hopeful because I know diversity, equity, and inclusion are interwoven into our curriculum. So we're sending out our students to deliver patient-centered care as administrators, as clinicians, and as health professionals. I'm hopeful. I'm hopeful because of all of you. Thank you all so much.